The tibia and the fibula make up the lower leg, which is referred to as the crural region. The tibia, remember, is medial to the fibula. So the tibia is the only weight-bearing bone, and often it's not broken as much as the fibula. Since the fibula is much thinner and it's also located laterally, it's easier to break. So there are medial and lateral condyles on the surface of the tibia that articulate with the femur. On the anterior surface of the tibia, there is a tibial tuberosity, which is an important attachment for the patellar ligament, also for a muscle called the tibialis anterior. Other important structures would be the medial malleolus, which is at the distal end on the medial side of the tibia. Other features of the fibula include the proximal head with a flat articular facet for articulation with the tibia, a narrow neck and slender shaft, and then the distal end has a lateral malleolus. So if I were to ask you which bone is the lateral malleolus on, you would immediately tell me fibula because you know the fibula is always on the lateral side. If I asked you what bone the medial malleolus was on, you would answer tibia because the tibia is always on the medial side. So let's look at this anatomy a little closer here. So I'm going to zoom into the proximal region of the tibia. We can see the medial condyle and the lateral condyle that articulate with the distal or with the patella. So there's a lateral condyle. This is just a proximal end of the right tibia, the lateral condyle and the medial condyle. We can also see those in this X-ray. So it allows the medial condyles of both the femur and the tibia to articulate. But of course, there is fibrocartilage in the form of menisci that are between those two condyles. On the anterior surface of the tibia, we find the tibial tuberosity, which is an important attachment for a muscle. Then we find the rest of the at the proximal end of the fibula is the head. At the distal end of the tibia and the fibula, we find the malleoli, the lateral malleolus on the fibula, the medial malleolus on the tibia. Those would be all of the different bone markings that you need to know on those bones. At the knee joint specifically, we see a posterior view and a lateral view here. When we look at the posterior view, notice you can see the lateral condyles on both the femur as well as the tibia. On the medial side, you can see both condyles as well, both the one on the femur as well as the one on the tibia. Looking at a lateral view, we can see the femur, patella, fibula, tibia, and notice the tibial tuberosity is on the anterior surface of the tibia. So we can't see the tibial tuberosity here because this is a posterior view of the knee joint, the popliteal region. On this slide, we can see the tarsals, and there are 7 bones of the ankle. The largest one is the calcaneus. And on the diagram to your right, the calcaneus is actually highlighted for you. The talus is the superior most weight-bearing one, which articulates with the tibia. So the talus will be sitting here. The navicular would be on the medial ankle. Then there are cuneiforms, 3 different cuneiforms, in fact. And finally, a cuboid bone, which would be this one right here on the lateral side of the ankle. For the metatarsals and the phalanges, not too many things are different between the metacarpals and the phalanges of the wrist. There are 5 bones in the sole of the feet as metatarsals, just like, remember, there were 5 metacarpals in the hand. They articulate with the tarsals proximally and distally with the phalanges. They're identified as number 1 through 5 from medial to lateral using Roman numerals. And finally, we have 14 phalanges, just like we have in the hand. There's 3 phalanges for toes 2 through 5, because each one of them has 3 long bones: a proximal phalanx, a middle phalanx, and a distal phalanx. However, just like the thumb, the great toe, which is called the hallux, only has 2 phalanges. So it has a proximal phalanx as well as a distal phalanx. This diagram is showing you the tarsals, metatarsals, and phalanges. So we can see the calcaneus as the largest of the tarsals, which is on the base of our foot. Just superior to that, or on top of the calcaneus, is the talus. Then on the lateral side, we have the cuboid, because it's kind of cube-shaped. The next bone that is just distal from the talus would be the navicular. Then there are 3 cuneiforms based on location. So going from the medial side to the lateral side, we have the medial cuneiform, intermediate cuneiform, and lateral cuneiform. So those are all of the tarsals. The metatarsals are numbered 1 through 5 based on which toe they're on. Then we have the phalanges, and remember there's 14 of those, but there's only 2 in the great toe: the distal phalanx of the hallux and the proximal phalanx of the hallux. In the rest of them, there's a distal, middle, and a proximal phalanx to make up the phalanges. And that's the rest of the appendicular skeleton.